Assalamualaikum. My name is Hafika Maisa binti Yusof. So as for my part, I will be doing on the introduction. Alright, as we all know that means Malaysia has faces a lot of challenges in meeting the Sustainable Development Goals number 1, which is eradicating the poverty with persistent issue despite economic progress. Absolute poverty remains a concern varying among states, with Sabah having the highest rate in poverty. While there's progress, the DOSM report a rise in absolute poverty from 5.6% in the year of 2019 to 8.5% in the year of 2020, partly attributed to the COVID-19 impact. The 12 Malaysia plans target reducing poverty, especially in less developed states. Relative poverty based on household income compared to the national median has increased from 15.9% to 16.9%, indicating ongoing social and welfare challenges. The urban-rural poverty gap reveals a persistent disparity, reflecting hurdles in narrowing economic gaps between rural and urban areas. Malaysia ranks 55th in the Human Capital Index, emphasizing the need for improvement in social safety, health, nutrition, and education for sustained development.
Hi, my name is Anastasia Leja. So today I will present about the poverty issue of low income. What is low income? Low income is referred to a financial condition in which people or family can earn an amount of money that seem unable to pay for their basic needs and maintains to a proper standard of living. According to the New Straits Times, to 2023 has defined poverty as the percentage of household that have a monthly gross household income less than the poverty line, which is monthly income below 2,589. There are many causes of the low income, which is one of the primary causes of low income, which is discrimination in structure within society. The second one is the global economic change. In Malaysia, there are three categories income, which is T20, M40, and B14. The T20, one of the population have the highest income. M40 is a middle income category, and lastly B14 represent the lower income part of the populations. Lastly, in Malaysia, in 2023, the specific household income category indicate a commitment to expect government that recognize the various aspect of the income gap. Malaysia has a stronger chance to carry out specific action that support comprehensive economic growth that and aim for more fair and just society by expanding the T20, B40, M40 category and including both median and means value in income estimates. That's all from me. Thank you.
Hi, my name is Viveka Maria. So today I'm gonna present about the issue of poverty has an implication in terms of malnutrition and food insecurity. So the term of malnutrition is about people that from low-income family may face challenges in affording a balanced and nutritious diet, leading to malnutrition and health issue. So this can affect to physical and mental development, immunity, and overall health. This can prove that people who is a malnutrition can get an effect like cause weight loss, tiredness, low energy level, reduced ability to perform everyday tasks, and increased risk of illness and infection. Secondly, the term of food insecurity is mean the ability of people who consistently access sufficient, safe, and nutrition food can result in food insecurity. This can implication for health and well-being, affecting both physical and mental health, such as increased risk of birth defect, anemia, lower nutrition intake, and cognitive problem. Thirdly, the implication of poverty is education access. Poverty made people to limited access for education. Not every country has a resources to provide an education access for their society. So, their country lack of resources such like inadequate water and food supply. This can be seen children living in poverty face numerous barriers to access education, including lack of access to school, untrained teacher, and limited resources. In many developing countries, children's access to education can be limited by factors such as distance to school, lack of property infrastructure, and gender inequality. Not only that, global citizens also found that nutrition given impact to education access. Good nutrition is crucial for good learning, and families living in poverty often struggle to provide adequate nutrition for their children. Apart from that, lack of resources is the impact for education access. For example, students from low-income families may not have access to computer, the internet, or other technological resources which are essential for research, communication, and collaboration. So that's all from implication.
Greetings, my name is Rebecca and I will be explaining about healthcare disparity. Healthcare is one essential needs that people must have nowadays because it will determine the person's long life and survival rates. So how is poverty going to have impact on healthcare? This is because poor people cannot afford to pay for expensive healthcare service. Poverty is a situation where the person only have enough to afford food and drink for their daily necessity, which lead them to not put importance on their own health. According to National Health Interview Survey, it was found that people who have lower income have high health risks and chronic disease compared to people who earn high and moderate income as they are able to afford for healthcare service. Sometimes, high cost of living also one of the main reasons why people ignore to get healthcare service. They need to pay for other bills, and for people who have family, they need to prioritize to provide for their children needs first before themselves. Besides from not able to afford healthcare service, the reason for healthcare disparity is people not able to have access to better quality healthcare service, where they did not have any hospital nearby where they live to get health checkup, and this often happen to people who live in rural or village area. They need to go to the city so that they can get healthcare service. It can be seen in Malaysia how some of rural and village areas still don't have access to healthcare service because there are no hospital nearby that was built for them to get health checkup daily or yearly. Next, poverty also will affect on economic growth. The higher rate of poverty, the more slower economic to grow. The reason for this is first, income equality, where there are big gap between people who have low income and high income. If more people have low income, it shows that they have problem to support themselves, especially nowadays the price to buy basic necessity is expensive, which lead to high cost of living. It might cause some of them will not do any purchasing on some product out of concern to save money for case of emergency. And if the economic growth is low, it will cause lack of job opportunity because people less purchasing things to save money, then there are no money flow and profit to support the business to keep running and also to pay worker. The less purchasing power by consumer, the less worker are required to work in that business, company or store, because the employer cannot afford to pay more workers and lot of people will be jobless. More people that are jobless, it will slow down the rate of economic growth. That's all from me. I will pass to the next presenter.
Malaysia faced challenges of malnutrition and food insecurity, particularly among low-income households. So, first one, the suggestion is promoting sustainable agriculture and food production to ensure a stable food supply. The government should implement and promote sustainable farming practices. This means that the government can include measures such as crop protection, agroforestry, and organic farming to reduce the environmental impact to agriculture and enhance soil health. For example, through the introduction of integrated agriculture with an emphasis on agroforestry, mixed farming, rehabilitation of marginal land, and so on. So, sustainable agriculture encourages practices such as organic farming, agroforestry, crop rotation, and so on. Secondly is government should enhance nutrition education and awareness to improve dietary diversity and quality, especially among low-income groups. So, government must ensure food security to prevent diet-related non-communicable diseases to people or children. For example, the government can make or provide school-based nutrition education program. This is integrate nutrition education into the school curriculum to promote healthy eating habit among children. So through initiatives such as school nutrition program, this can raise awareness to healthy eating and improve the nutritional knowledge, attitude and practices of school children. So that's all for the suggestion. Thank you.
My name is Vishora Ananyandau. I will explain about the second suggestions, third suggestions, and fourth suggestions. For the second suggestion for the low-income poverty issue is government provide low-cost housing. Malaysian low-cost housing is specifically designed to improve the standards of living of the low-income population. Malaysia launched several affordable housing programs to give people with low income with low-cost housing option. Therefore, one of the initiatives provided by the government is Program Perumahan Rakyat (PPR), often known as People Housing Program. This program is Malaysian government project to create low-cost housing development for families with monthly income of 2,500 or less. Other than PPR, government also came up with an initiative, Rumah Mesra Rakyat program that was created to support people with family income of less than RM5,000 who do not own a home or live in outhousing but do have land on which to build their own home, and it is a subsidy housing assistance that provided by Syarikat Perumahan Negara Berhad (SPNB). This both initiative focus on dealing with housing affordability issues and make sure that low-income people have access to adequate and affordable housing. Next is low-income poverty often face issues with education access because of their difficulty. Many children or young people do not get proper education and even cannot further their studies to a higher level because of the financial issues. Therefore, government come up with initiatives such as school assistance like textbooks loan scheme (SPBT). Every student in school will be provided a set of books by the government to help them learn, as well as to ensure that students from disadvantaged families do not drop out of the school and can less the burdens of the parents in providing their child to have proper schools. School Assistance Scheme, or known as Skim Bantuan Persekolahan (SBP), is involved in giving one-off financial aid. RM300 is given for the primary level, while 500 is for secondary level. As for the young people with the range of age 18 and above who want to pursue their studies in higher education, it is crucial to be aware of the scholarship program provided by the government. There are various scholarship programs such as Bantuan Kewangan Pelajar College Community (BKPKK). This scholarship program goal is to help the students from the low-income families to continue their studies at the professional level, improve their life skill and become more competitive, as well as to help students improve their socio-economic level for their families and themselves. The student will be given RM300 allowance for every month for 3 semesters. Other initiatives such as PTPLN also is an education loan scheme was established to provide loans to students and attending public and private higher institutions. This education loan will help students fund full or partial tuition expenses as well as the cost of living while studying. At the same time, it encourages greater possibility for the student to pursue higher education. Due to that, public universities such as UiTM are created to help P40 group families pursue the study due to their low cost and affordable fees. Is insufficient income has always been a barrier for the low-income population to gain access to essential healthcare, a comfortable living environment, and enough nutrition. Low-income families always face challenges in getting health access due to short of money. Therefore, Malaysia provides public clinics such as Urban Transformation Center (UTC) clinics and One Malaysia Clinic, or known as Community Clinic. UTC is the Malaysian government effort initiative to provide central government and private sector service to the urban community under one roof. UTC provide many types of services, and health services are one of the services that help many low-income people to get health access with the low-cost fees. Aside from that, the One Malaysia Clinic initiative is also one of the significant programs which is build low-cost clinic to provide vital healthcare service. One Malaysian Clinic right now has been rebranding to Community Clinic, said Dr. Zulkifli Ahmad, the health of minister at that time. However, these clinics are designed exclusively for people with low income, giving low consultations, medicine, and basic medical service. This initiative is a good example of the government effort to ensure people well-being, particularly by providing high-quality medical service at a reasonable price, which is people only paid RM1 for the treatment and medicines. Other than that, the government also came out with community health outreach program, bring healthcare directly to the communities, particularly people with little accessibility to traditional healthcare institutions. This initiative seeks to raise health awareness, provide preventive treatment, and meet basic healthcare needs. One of the example is in Malaysia, such programs like mobile health clinics. This major purpose of this program is to reach out to isolated or underprivileged population and provide healthcare services right at their door. Example is Great Heart Charity Association's collaboration with the Malaysia Red Crescent in Pahang for Orang Asli Community Treatment Project. That is all from me. Thank you.
As for the conclusion, poverty in Malaysia persists despite economic growth impacting healthcare, education, and employment. Addressing this requires a comprehensive strategy tackling various aspects of deprivation. Healthcare, sustainable employment, and education policies are very crucial. Bridging economic disparity and urban-rural gap, along with combating social exclusion, discrimination, and implementing effective government programs are the key components. Breaking the poverty cycle involves focused initiative, strengthening social safety nets, empowering marginalized population, and enhancing skills development. Regular assessment and adaptation of anti-poverty plans to evolving socio-economic conditions are essential for sustainable progress. Last but not least, Malaysia's goal is to achieve an inclusive and equal society through continuous efforts in promoting development that uplift all residents from the constraint of poverty. That's all from me. Thank you.